A warm welcome, my dear students, in our health class. To formally start our discussion, first, let us identify the following. Content standard. Performance standard. And most essential learning competencies. To jumpstart, let us recall the definition of health. It is a state of complete physical, mental, and social well-being and not merely the absence of disease or infirmity. It is most often being related to solely the physical well-being of an individual. It is not more than looking healthy, but an individual must also be feeling, thinking, and interacting healthy to achieve wellness. Well, disease is a particular abnormal condition that negatively affects the structure or function of all or part of an organism, and that is not due to any immediate external injury. Diseases are often known to be medical conditions that are associated with specific signs and symptoms. The topic for 4th quarter Health 7 is about non-communicable diseases. For the pretest, you're going to differentiate myths and fallacies to fact file. You only have 15 seconds. Ready? For the answer, a fallacy is often based on a correct argument but applied to a wrong set of circumstances. A myth is a worse form of fallacy because it is not true or correct, while fact file is containing essential information about a product, substance, service, or other topic. For today's topic, we are going to focus on non-communicable diseases, fact file, myths and fallacies, and self-monitoring skills. Let us begin with myths and fallacies that can directly or indirectly impact our health. Myths about non-communicable diseases. All NCDs are preventable, unrelated to infectious diseases. You cannot change human behavior when it comes to NCDs. Too expensive and complex to treat. No cost-effective solutions exist for NCDs. And NCDs are mainly diseases of the elderly and rich. The next part are the fact file about NCDs. These are some fact file from World Health Organization about non-communicable diseases. NCDs are responsible for 63% of all deaths worldwide. 80% of NCDs deaths occur in low and middle-income countries. More than 9 million of all deaths attributed to NCDs occur before the age of 60. Eliminating major risk could prevent most NCDs. Around the world, NCDs affect women and men almost equally. NCDs are largely preventable through effective interventions that tackle shared risk factors, namely tobacco use, unhealthy diet, physical inactivity, and harmful use of alcohol. Tobacco use kills nearly 6 million people a year. 5 billion adults 20 and older were overweight in 2008. Nearly 43 million children under 5 years old, 5 million adults and older were overweight. At this point, you will learn about self-monitoring and health practices to avoid non-communicable diseases. The self-monitoring skills are competencies that will help us assess when we are healthy or sick. It is important that we are familiar with the normal condition of our bodies so that we can detect at once when something is wrong. It is also important that we have information such as our vaccination record to ensure the health, safety, and well-being to provide preventive measures. Monitoring health practices. Do you think your practices help you avoid diseases? Health monitoring is very important in terms of prevention, particularly if the early detection of diseases can reduce suffering and medical costs. The diagnosis and prompt treatment of various diseases can radically improve alternatives for the medical treatment of the patient. For the activity entitled Monitoring Health Practices, you are going to put check or X based on your health practices. Please write your answer in your notebook. Ready? I get enough sleep. I consult a doctor when I observe something unusual in my body. I exercise regularly. I eat vegetables and fruits. I don't smoke. I monitor my weight regularly. I drink enough amount of water. I avoid eating foods that are too salty, sweet, or fatty. I make sure that the food I eat is nutritious. I properly manage stress. And for the rating, a check corresponds to 1 point. If you get a score of 8 to 10, it means very good, while getting 47 means good, and 1 to 3 means fair. In addition to the monitoring health practices, here are some checklists of safety health measures. Maintain personal health hygiene. Have a regular checkup. Create awareness in community. Be considerate of the health of others. Avoid risk factors associated with non-communicable diseases. And of course, self-care. And for the last part is the self-management. Self-management appears to be an effective means of improving health outcomes in life. It enables the person to better manage their health. Examples of self-management are body mass index monitoring, blood pressure, heartbeat monitoring, and regular checkups. And for your activity entitled My Commitment to Prevent and Control Diseases, you are going to trace your right hand on a clean sheet of paper. On each finger, you will state your personal commitment to prevent and control diseases. You can go back with the self-monitoring health practices and use them as a guide in writing your contract. Don't forget to ask your parent or guardian to sign on it along with your signature. That is the end of my presentation. I hope you learned something about non-communicable diseases. Here are the references that I've used in doing my video lesson. Photos used here are from Canva. This has been your teacher for today, Mrs. Cynthia Soledad S. Aspe. Thank you for watching! But before I leave, I would like to share something to ponder. Investing in our health is the biggest investing we can make. Keep safe always!